All right. Good morning, everybody. Welcome. My name is Mary Leonard. I have the great privilege of serving as the director of the Maternal and Child Health Research Institute, and really excited to see all of you here today. We have an incredibly invigorating program, and just going to kick it off. I'm going to tell you a little bit about MCHRI for those of you who may be new to the Institute. Much of what I'm going to say will be rotating through the screens over the course of the day if you want to get more information. But just by way of background, the Institute was founded in 2009 as the fifth institute in the School of Medicine, and we are the one that is just doggedly committed to creating a community across the entire university that is dedicated to maternal and child health. And to that end, we now have an extraordinary 1,400 members, and we are very proud that our members and much of the funding that we have has gone out to every single school on this campus, as well as all of the clinical and basic science departments within the School of Medicine. Everything that we do has made possible by first three different sources of funding. One is we get very generous support from the Children's Hospital. So every year, the CEO of the hospital gives a substantial amount of money that's used for many of the new programs that you've heard about in recent years. Expanding our grant programs, but also a lot of the infrastructure programs, our real commitment to young folks. So the DRIVE program, where we bring, undergraduates into our labs, a lot of the whole variety of things we do is made possible by these funds that come from the hospital. The other really critical source of funding has come to us from the Lucille Packard Foundation. Most of our grant mechanisms are through endowments, and you can see when people hold these grants if they're named. But we also get a significant amount of money every year that's very discretionary through the Children's Fund. So if you donate to the Children's Hospital, you just go in and donate in a generic fashion, don't specify, a third of it comes to us. And that's been a really powerful resource. And then this year, for the first time, MCHRI had a team in the Scamper fund run. And in that particular case, all of the funds came to us. We also were very fortunate that Ruth O'Hara, the Senior Associate Dean for Research, gives us funds through the CTSA. So we're very grateful for all those sources of funding. We have three main pillars for the things we do. The first, which I've already referenced, is the grants that we give out. Last year, we awarded an extraordinary 145 grants, totaling over $10 million. There's a whole spectrum of grants, and you can find all of this on our website, but there's seed grants, new idea grants, pilot grants. We are really committed to funding postdocs. We think one of the best ways to get the brilliant scientists on this campus thinking about maternal and child health is to fund a postdoc in that lab to help them move in a new direction. So we've been investing significant resources into postdocs. One of my favorite things we do is the TIP grants, the transdisciplinary grants that require you have a co-PI who is in another school on this campus. And I really encourage you to look at the website and see the kinds of things that our School of Medicine faculty have been able to do with everything, obviously a lot in computer science and engineering, but really across all the schools on campus. I mean, we're very happy that we awarded a TIP last year to the sustainability school. So we're really connected with all the schools. We have partnership grants with other institutes with programs like the Diabetes Research Center or the Center for Innovation and Global Health, where if they give out seed grants, we say, if one of them is in maternal and child health that you think is exceptionally strong, we'll fund it. So that's another way of just constantly elevating the visibility of maternal and child health. We think we are the single biggest funder of postdocs across the entire campus. The DRIVE program right now actually is the time when we'll put out a call for mentors. This is the program where first generation low income Stanford undergrads come into our community. And that's funded by the foundation through the Children's Fund, but also the Vice Provost for Undergraduate Education. They've been funding a significant number of slots because it's been such an impactful program. What's wonderful about that program is we get undergrads from all different majors. Obviously, we get a lot of hum bio majors, but we also get biology and psychology and chemistry. And really delighted this year that the mentors came from 8 different departments across the School of Medicine. So please think about doing that. When you give out that many grants, you need a lot of study sections and you need a lot of reviewers. We have 18 different study sections with 120 faculty reviewers. So to all of you who have served as a reviewer for any of our funding, thank you very much. And if you've been a recipient of our funding, we hope you'll consider volunteering for some of those roles. And really special thanks to Kim Stern, who's just masterful at juggling all of those RFAs and those grants. Something else we've done that's been really powerful and new for us starting a couple of years ago is using MCHRI to enable philanthropy. So when I was having a conversation with a donor who said, I want to fund something in this specific disease, but I don't know who to fund. I said, let us a group of experts decide. And I explained what the concept of an RFA was and what a study section was. We've now done that multiple times and it's been really powerful. So for instance, when we had a donor that wanted to fund research in IDD, we've done a series of seed grants, and I'm sure you'll see some that's probably on these rotating slides. But now we have a stunning 35 faculty on this campus doing work in IDD, a few who I dare say didn't know what IDD stood for when we first announced it, and now they're all in. And so that's been an incredible return on investment with more than 30 publications, including publications in Nature and Cell, and more than 7 million in extramural funding. And now we have open at our children's hospital 10 clinical trials in IBD. So that's been really exciting. And then the newest grant mechanism that's sort of using that playbook is the Kidney Health Innovation Fund. So you may see that. So that's grants. The next thing we do is infrastructure. From the very beginning, when I came into this role in 2016, we partnered with the Quantitative Sciences Unit, so our maternal and child health investigators have resources there. But I think one of the most powerful things we've done is creating the Clinical Research Support Office, which was really inspired by the great bones that Mary Chen had created with a group of very experienced clinical research coordinators, but led by Allison Falwell and Carl Sylvester. They've really taken this to a new level. If you are doing research that in any way touches anybody that has a medical record number in the hospital, the first person you should be calling is Allison Falwell. And they do an incredible job of helping you navigate everything from pharmacy and imaging and to Epic. And that's been really powerful. And I think the real reason that's been so successful is because our hospital executives, and a special thanks to Rick Majan, our chief operating officer, information officer, nursing officer, all of them are on the governance for this Clinical Research Support Office, which is so powerful in helping all of you navigate research within the walls of a children's hospital. And really a great demonstration of the impact of this is at the hospital this year named Carl as Packer's Chief Research Operations Officer. The other thing we've done in terms of creating much stronger community with the hospital to break down this notion that, hospital research happens in the School of Medicine. We're like, no, actually research is happening in the hospital right now. So we've had community events where we bring hospital managers and leaders together with the researchers, and that event draws over 300 attendees. So be on the lookout for those. They happen annually in the fall. Another major milestone for us is PCHA, which is the very large network of practices that are not our faculty, but are run outside of the faculty and by the hospital. We now are doing active IRB approved research within that group. So that's a great milestone. The Clinical Research Support Office fielded over 450 requests and supported over 800 active studies in EPIC. And then the Clinical Research Coordinator Services that I mentioned have supported over 200 studies. And if you look at our annual report, if you're interested in this, you can get a lot more information. It's a fabulous report of all the different accomplishments and a lot more details. When we put in place all the things to make it easier to do research in patients that are in our healthcare system, our community engaged researchers said, yeah, that's great, but what if we're working with kids that aren't our patients and kids who are in the community, maybe who are healthy but not thriving? We need support to get out and do community engaged research. So we established the Office of Community Engaged Research led by Anisha Patel and Dong Mei Tan. And they now have provided support to dozens and dozens of projects. They have all kinds of workshops, toolkits. A really important milestone is that they worked with the Stanford Medicine's Office of Community Engagement to provide training for staff on our community engaged research. They formed a working group with the IRB leadership and a variety of leaders to really address IRB related challenges for community engaged research, and very importantly, received approval for city certification research training for community partners. And then the last thing we did in terms of infrastructure that I hope you're all aware of is we now are a member of PedsNet, which is a learning health system where I think it's up to 13 now children's hospitals we all send our entire electronic medical record, if you can imagine, to the Central Data Coordinating Center. But there's now over 15 million kids are in the PedsNet resource. So if you're interested in accessing that for research, we're here to support you. Alan Schroeder, Keith Morris, and Jessica Whalen lead that. And we got over 4.5 million in research funding to date with 30 publications with Stanford researchers in PeaceMet. So just want to make sure everyone's aware of these incredible resources, all to try to enable this kind of work. And then the last pillar is education, and that's really what brings us here today. The Education Committee, conceived and led so brilliantly by Tony Oro, launched this symposium. It's been really powerful. Every year they pick a hard topic. Last year was AI and disinformation. The year before was climate. Here, as you'll see from the program and Tony, the real interface between the mother and the baby, and the genetics and the environment, and it's such an important theme for us. But they also do monthly seminars. They are recorded. They're on the website. Take a look at the wealth of incredible resources that are available. Some of them are more tactical in workshops. Others are really about the cutting edge science. So the Education Committee has put together this symposium and puts together the incredible things over the course of the year. There will be slides acknowledging all of them, but we're so grateful that we have representation from so many different departments. This symposium, we have 370 registrants. We had well over 100 abstracts. A good proportion of those were submitted by trainees. We are so deeply invested in our postdocs, our people on K grants, and we're so happy to see them represented here. We have 20 different departments that are represented across these abstracts, and importantly, 10 come from our Drive scholars. So the fact that they came in with us for a summer but actually have an abstract at this meeting. So also need to give a special shout out to the dozens of abstract reviewers. It was a really big list. Now, when I sent my remarks to Mary Chan to check my facts, I had at the end a special thanks to Mary Chan. And when she sent it back to me, in true fashion, she had removed that. So Mary, you held off the book. Mary Chen and her team were here, I don't know what time yesterday morning, and then we had an extraordinary dinner last night. We never, ever could do any of this without Mary Chen. She has been MCHRI before it was MCHRI, when it was CHRI, before it was CHRI, when it was just sort of a glimmer in someone's eye a very long time ago. So we're really, really grateful to Mary, but also Lynn and Grant and Harmon and the team that puts together the annual report. This is an extraordinarily talented, dedicated team that made the symposium possible. So special thanks to Mary and welcome. And Tony's going to come tell you more about the program. Thank you.
All right, good morning. Thanks for coming up early. So we're so excited you're here because this day is going to be a very special one. You know, when I'm Tony Orwell, one of the co-directors for the MCHRI, and these symposiums, when we started them 8 years ago, we wanted to highlight an important question, emerging question in the field. And the institute was started in 2010 as the Fifth Institute at Stanford. It was CHRI. And then thanks to Virginia Wynn, who will be actually honored as a visionary leader with remarks from Mary after lunch, we added the M, which is maternal. And why did we do that? Because we realized that even though the developing embryo and the genetics, there's a lot of environment that goes on. And what's the most important one of the most important environmental factors? The mother, the M. And so today, we're trying to basically highlight the M in MCHRI, understanding the genetics by environmental interaction, the conversation that goes on from the start, antenatal, perinatal, and also even into adulthood, this adolescence, this mother and child interaction that optimizes child output. And so really that's the question for today. And always in science, the question is not what's next, but what are we missing? What don't we have? What are technologies? What information don't we have? What ways of basically understanding, getting information don't we have? And you might have talked about this last night at the dinner. For example, technologies like microfluidic ability to separate maternal and fetal chromosomes which was developed at Stanford by Steve Quake, has revolutionized prenatal diagnosis. Right? We don't even do amniocentesis very often anymore because of that. And so for you in the audience, the question is, what can we do? Where are the holes? And how can we make a difference? What information do we need? What technologies for the future? Okay, so that's your challenge today. Don't just sit there and listen in, but really start thinking about how can you make a difference for this maternal and fetal interaction. So we have 3 sessions: maternal fetal correlates to disease, really understanding the maternal fetal interaction, and then on a mechanistic basis. Second will be the epidemiology of that information. How does that play out in the community? And the last one is what technology gathering events or devices do we have and can we do that? Such as like real-time and continuous ultrasound, which you'll see. So it's a really exciting day. And in the middle, there'll be lunch, and then we'll honor Virginia Wynn. And then there's poster sessions. We have 100 amazing posters. This is actually my favorite part of this meeting. Just spend the time. There'll be 2 breaks, and at lunch you can basically look at the posters, walk around. I can't tell you how many interactions I've had and collaborations have started because of the posters. Okay, and so with that, I'll stop and then ask Christy to come and introduce the first session. So exciting day. Strap in.